Welcome to the MD Edge Daily News for Monday, July 23rd. I'm Nick Andrews. Today, nerve growth factor inhibitor shows phase 3 efficacy in osteoarthritis. National Academies issue 5-step plan to address infections linked to opioid use disorder, and trial data suggest beneficial class effects of SGLT2 inhibitors. But we begin today with better survival, but more brain damage in the use of epinephrine for cardiac arrest. Using epinephrine for cardiac arrest improves 30-day survival by less than 1% and nearly doubles the risk of severe brain damage among survivors. This is according to results of the Paramedic 2 randomized double-blind trial published in the New England Journal of Medicine. In the trial, after initial CPR attempts and defibrillation failed, over 4,000 patients were given epinephrine and about 4,000 were given saline placebo. Epinephrine doses were either 1 mg intravenously or intraosseous infusion every 3 to 5 minutes for a maximum of 10 doses. The heart restarted in over 36% of patients in the epinephrine arm, which was more than 3 times more than in the placebo arm. Also, 39% more patients were alive at 30 days in the epinephrine arm compared with the placebo arm. However, only 3.2% of patients in the epinephrine arm were alive at 30 days. That slight benefit came at a significant cost because of the 126 epinephrine patients who survived to hospital discharge, 39 had severe brain damage. Of the 90 patients who survived 30 days in the placebo arm, only 16 had severe brain damage. The researchers defined severe brain damage as the inability to walk and tend to body functions or persistent vegetative state. Two subcutaneous dosages of tanezumab showed significant benefits in patients with osteoarthritic joint pain. This is according to the results of a multi-center randomized phase 3 trial of nearly 700 patients. In the trial, the 16-week responses to 2 subcutaneous injections with tanezumab spaced 8 weeks apart showed statistically significant improvements in pain, physical function, and patient global self-assessment compared with placebo. The study enrolled patients at nearly 100 centers in the U.S., Puerto Rico, or Canada with confirmed moderate or severe osteoarthritis of the knee or hip. About 1% of patients stopped treatment because of an adverse effect, and less than 2% of patients on the drug had progressive osteoarthritis during treatment compared with no patients in the placebo group. Tanezumab is a nerve growth factor inhibitor that is being developed by Pfizer and Lilly for an indication of osteoarthritic pain as well as for chronic lower back pain and pain from cancer metastases. The drug is a humanized monoclonal antibody that binds to and inhibits nerve growth factor. This inhibition may prevent pain signals from reaching the spinal cord and the brain. Back in June of last year, both Lilly and Pfizer announced that the development of tanezumab had received fast-track approval from the FDA for the indications of treating chronic osteoarthritic pain and chronic lower back pain. The two drug companies report that patients showed good tolerability to tanezumab treatments with no new safety signals and no osteonecrosis. Widespread opioid use disorder has sprung new epidemics of hepatitis C virus and HIV infections, as well as increased hospitalizations for bacteremia, endocarditis, skin and soft tissue infections, and osteomyelitis. This is according to a report from a workshop by the National Academies of Science, Engineering, and Medicine titled Integrated Diseases Considerations with Response to the Opioid Epidemic. The authors of the report outlined 5 action steps. First, to implement screening for OUD in all relevant healthcare settings. Second, immediately prescribe effective medication for OUD and withdrawal symptoms for patients who test positive. Third, develop hospital-based protocols that facilitate OUD treatment initiation and linkage to community-based treatment upon discharge. Fourth, hospitals, medical schools, physician assistant schools, nursing schools, and residency programs should increase training to identify and treat OUD. Fifth, increase access to addiction care and funding to states to provide effective medications to treat OUD. The report notes that opioid withdrawal and pain syndromes should be addressed with opioid agonist therapies to optimize infectious disease treatment and relieve pain. The workshop was held this past March. You can find videos and a slideshow presentation from the meeting by clicking the link in the description. And finally, today, sodium glucose transporter 2 inhibitors, including dapagliflozin, have a beneficial class effect on major adverse cardiac events, all-cause mortality, and renal function. This is according to post-hoc analysis of data from the Excel trial presented at the 2018 annual scientific sessions of the American Diabetes Association. In the Excel trial, 10% of patients took an SGLT2 inhibitor, and about half of those took dapagliflozin. In the current analysis, researchers examined the effects of all SGLT2 inhibitors and dapagliflozin alone compared to those patients who received placebo. SGLT2 inhibitors were found to numerically decrease the major adverse cardiac event hazard ratio, and SGLT2 inhibitors significantly reduced all-cause mortality risk. Major adverse cardiac events represented a composite endpoint of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. Major events occurred in 28 patients in the SGLT2 group, compared with 44 patients in the control arm. Dr. Lindsay Clegg is a postdoctoral fellow with AstraZeneca Quantitative Clinical Pharmacology Group in Gaithersburg, Maryland. Dr. Clegg says that for dapagliflozin, the numbers were pretty similar, though not statistically significant because the number of subjects was smaller, but similar. Indeed, 11 patients who received dapagliflozin experienced a major adverse cardiac event, compared with 22 in the control arm. The overall SGLT2 inhibitor all-cause mortality findings were very similar to what was seen in the CVD REAL trial, which is a real-world evidence trial which looked at cardiovascular outcomes in new users of SGLT2 inhibitors. And that concludes this edition of the MD Edge Daily News on a Monday. You can find links to these stories in the podcast description. The Daily News is published every day at 4 a.m. You can make us a part of your daily routine wherever podcasts are found. For MD Edge, I'm Nick Andrews.